Hi everyone, and welcome to my presentation. My name is Dr. Shiva Hadadnan, and today I would like to concentrate on osteoporosis. So let me share my slides. Okay, as you can see on the screen, our topic today is osteoporosis in women. So what is osteoporosis? The body absorbs and replaces bone tissue constantly. Osteoporosis develops when new bone creation doesn't keep up with bone removal. So osteoporosis is a condition in which bones become weaker and lose their strength. Who gets osteoporosis? Most people reach their peak bone mass in their early adult life until their late 20s. By the time we reach age of 35, we gradually start losing bone mass. The risk of osteoporosis grows as we get older. The thicker your bones are at about age 35, the longer it takes for you to develop osteoporosis. It is interesting to know that osteoporosis is 4 times more common in women than men in the same age group. In fact, the hormonal changes that happen during menopause have a direct effect on bone density. Now, let's talk about bad habits that affect your bone health. Eating too much protein, lack of sun exposure, smoking, high salt intake, and drinking too much alcohol increase your chances of getting osteoporosis. It is definitely important to know what causes osteoporosis so you can take preventive steps to stop it and lower your risk of bone fracture. Does breastfeeding lead to osteoporosis? When a woman is breastfeeding, she may have some temporary bone loss. This bone loss is caused by the growing baby's increased need for calcium. This calcium is drawn from the mother's bone. However, bone density appears to recover rapidly after weaning and shouldn't cause long-term harm to a woman's bone health. It is important that all women who are breastfeeding get enough calcium, vitamin D, and appropriate exercise to keep their bone healthy. So, how does menopause affect bone density? When you reach menopause, the drop in estrogen level speeds up bone loss and increases the risk of osteoporosis. After menopause, the ovaries produce very little estrogen. Low level of estrogen can cause bone resorption and inadequate bone formation and leads to osteoporosis. What are the symptoms of osteoporosis? Osteoporosis is a silent disease that usually has no symptoms. However, you may experience one of the following symptoms with osteoporosis. First, loss of height. You may get shorter by 2 centimeters or more. Second, change in posture. You may stoop or bend forward. Third, shortness of breath. You may have smaller lung capacity and experience breathing difficulty due to compression fracture in vertebrae. Fourth, bone fracture, or you may experience pain in the neck or lower back. There is also a chance that you break a bone in a relatively minor fall or accident. Do you know what the bone mineral density is? A bone mineral density test uses X-ray to measure the amount of calcium and other types of minerals in the bones. It estimates how thick your bones are. It is quick and painless. Based on the American College of Obstetricians and Gynecologists' recommendation, all women who are 65 or older should have a bone mineral density test. Menopausal women who are younger than 65 should have a bone mineral density test if they have had fragility fracture or have other risk factors for osteoporosis such as rheumatoid arthritis, hyperthyroidism, smoking, alcoholism, a history of hip fracture in a parent, or a body weight less than 127 pounds. Now is the right time to talk about the DEXA scan and its result. The most commonly used bone mineral density test is called the DEXA scan test. It measures bone density at your hip and spine. During this test, you lie on a soft table for about 10 minutes. The scanner passes over your lower spine and hip. In most cases, you don't even need to undress. After the test, a T-score is given for each site measured. A T-score of 0 means you have no bone loss compared to a 30-year-old woman of the same age. A T-score between -1 and -2.5 means you have a low bone density, osteopenia, and may be at risk of developing osteoporosis. A score of -2.5 or below means that you have osteoporosis and treatment is usually recommended to prevent fractures. Now the question is, how often should women have bone mineral density tests? According to the American College of Obstetrics and Gynecologists, how often you should measure your bone mineral density test depends on your age and the result of your previous test. Women who are 65 and older with normal bone mass or mild bone loss can have a test every 15 years. However, women in this age group with T-score between -1.5 and -2.49 should repeat bone mineral density tests more frequently. What is FRAX? The Fracture Risk Assessment Tool, or FRAX, is a free online tool that estimates the risk of having a major osteoporotic fracture within the next 10 years. FRAX predicts the fracture risk using information about your age, sex, body mass index, smoking, alcohol intake, and other risk factors for osteoporosis. Which foods help us in building strong bones? Eating foods that are rich in calcium and vitamin D helps in making stronger bones and combat osteoporosis. Good sources of calcium include dairy products such as milk, cheese, and yogurt. Almond. Green leafy vegetables such as broccoli, cabbage, kale, and okra. Soy products such as tofu. Soya beans. Plant-based drinks such as soya drinks with added calcium. Remember, sardines and salmon are also loaded with calcium. Does exercise have a role in preventing osteoporosis? Exercise can improve your body's strength and mental health and boost your overall health and longevity. Regular weight-bearing exercise such as brisk walking, hiking, jogging, stair climbing, jumping rope, and dancing plays a vital role in building strong bones and slowing mineral loss from bone. The Centers for Disease Control and Prevention recommend that healthy adults get 150 minutes of exercise a week, which is about 30 minutes on most days of the week. And finally, is there any treatment for osteoporosis? Various medications are used for osteoporosis treatment. Bisphosphonates are usually the first choice for treating osteoporosis. These include Fosamax and Actonel. But remember, you should talk to your doctor before starting a medication. Thank you for your attention.